Acknowledge that.
Thank you very much.
The next speaker, Mr. Juan Gonzalez.
Mr. Gonzalez is here.
To be followed by Mr. Zaf Tahir.
Oh. Mr. Gonzalez is not here, so Zaf.
Good afternoon, Mayor, City Council. You know what a difference 2 weeks make. Back here in front of you, focusing on bread and butter issues that our region faces. Also want to focus on the excellence and the professionalism that is in our diverse city, especially in our South Asian, Muslim American, Pakistani American community. I'm here to really introduce you to Dr. Faisal Masud, who is Director of Critical Care at Methodist. He concurrently serves as professor at 3 different institutions. He has been trained at Duke and Cleveland Clinic. His initial college degree was from Rawalpindi, Pakistan. I know for a fact, and I have known patients, my father included, that he and his team have brought back from jaws of death. He is a person who is dedicated as an individual. He is dedicated to the city. As a couple, he and his wife, Tahmina, do a lot for this city. And it is my pleasure and honor to again point out to the excellence that we have in our community, the top-notch professionalism that is in our community. One last thing I want to add is he has spoken extensively.
Go ahead on, finish
He
up.
has spoken extensively about this subject that is in front of you in China, Canada, Saudi Arabia, Dubai, Brazil, and today he'll be speaking to you. Thank you so much.
Thank you, Zaf.
The next speaker, Mr. Faisal Masud. Faisal Masud.
Good afternoon. Thank you
Good
for allowing me
afternoon.
this opportunity. Thank you, Mayor and Council. I would love for Zafar to introduce this to my wife. I mean, that'll be great. This topic is really, I'm here to talk about sepsis. And I don't know how many of you know about sepsis, but it is very bad amount. Just to give you a little bit of background, it is a hyperreaction of the body to an infection. Not all infections get septic, but majority of them gonna get septic. And if you get septic, your chance of dying becomes 30%. 30% can be a number. It can be alive, alive, dead, alive, alive, dead. 1.7 million Americans get it. 270,000 die from it. It is really one of the key things. 80% of people present to the hospital with sepsis. And my focus really is to make people aware about sepsis, because a lot of people who are vulnerable are 65, elderly, chronic diseases like diabetic, renal issues, and other things. If you don't raise awareness, and I'm here on behalf of my patients because I want them to know what sepsis is. I want them to know the signs. And signs can be getting fever, chills, breaking down, and infection is getting more worse. It's a medical emergency. I've given you some handout for you to be aware of it. Because if you don't do, most people die. This is the 4th largest city in the country, and a lot of people are dying. Whether if you die from flu, you die from septic. When you cancer, when you get chemotherapy, you're more risk of dying is from septic. Okay, and that's really the key thing. I'm seeing my patients die on a regular basis. I cannot afford that. I can't avoid them. I need your help to raise awareness. I'm here to offer my services. My mother passed away from septic. Even if you get septic, when you recover, you pay a price from recovery and a lot of rehab. We spend millions of dollars, and no disease, like if you have a heart attack, 30% are not dying. They're dying from septic shock. So I humbly request you for your assistance. I'm here to offer my services. Whatever I can do to raise awareness, it is for my patients. I cannot just watch them die. Please look at the information, CDC and everything, raise this awareness, because this is what has to be. It is in Spanish, it is in English, in multiple languages. Be aware of that. Share with your loved ones. If you get septic, I want people to ask one simple question. Do I have sepsis? Ask your healthcare providers, ask your doctors, ask anybody else. We can take care of it, because if you go into shock, 1/3 to 1/4 will die. And we'll be spending millions of dollars on that. It's an unnecessary, avoidable. There are a lot of things very simple with hygiene, awareness, immunization, which can minimize that. So that's my humble request. It's a strange thing for me, but I'm very honored to be there, and I request you that we have to look at it and raise awareness. A lot of people, more people die from sepsis compared to breast cancer, prostate cancer, and colon cancer combined. It is not to minimize any disease, but when you get chemotherapy from septic, that's when you're most vulnerable septic. That's why we have partnered at Methodist and other places to raise awareness to do that. We did a lot of work. Last month was sepsis awareness work, and we really, it is not a glamorous disease. But let me assure you, this is how people pass away. Thank you so much.
Thank you. 1 second. Hold on 1 second. Thank you, Doctor, for being here, and thank you for the information that you're sharing with us today. Councilmember Cisneros.
Thank you, Dr. Masud. When you mentioned, people that are older get this, it's common. But I had a child that I taught in 3rd grade who came down with sepsis, and when she was at Texas Children's Hospital, at one point she was the 2nd sickest child at Texas Children's Hospital. I mean, what a terrifying thing to be told as a parent, that you're the 2nd sickest child in the whole hospital. She survived, but I mean, but at a terrible cost. I mean, she lost, to amputation some of her fingers and toes, and she is not the same child. She was bright and funny and ambitious, and a lot of that has just gone from her. And,
so you're absolutely right. Actually, the young children, patients with any coronary disease, are early, they're most vulnerable. 2 most common is infections in your lung and infections in your urine. Those are the 2 most common. And these children, their lives will change. Jim Henson, Muppets gentleman, died from septic shock. The last pope died from septic shock. Whoopi Goldberg was very sick. She was given 1/3 chance, 2/3 chance of living. But that's why I want to raise awareness, because if we treat them, we can prevent. This child's life is altered. And as a society, we'll be supporting the child and family thing. But as a parent of children, I don't want to see that. I want that to be picked up. That's why I'm here to request that. It's a very strange thing. I'm more used to speaking to physicians and other. But I think you all can make a difference because you lead the society.
well, thank you for sharing this and spreading the word about it. Appreciate you.
Thank you. Councilmember Christie.
It is a timely topic. I think 48 hours ago, the most famous African-American opera singer died from sepsis. And she had a 50-year history in leading the opera world. So let me ask you a question, as if I'm a student in your clinical instruction class. So you mentioned chemotherapy will make you vulnerable to sepsis because it destroys the good white blood cells and polymorphonuclear. So what is the variable in the overuse of antibiotics before they go into the hospital and the vulnerability to infection because of the mutation and because of the overuse of antibiotics? Is that a credible concern?
So you're absolutely right. You bring up 2 issues. One issue is first of all, address your antibiotic overutilization. The downside of that, with world over, we're dealing with antibiotic resistance. Right. And if you keep on using indiscriminate antibiotics, then we already have choices to that, and we are facing that as a society. And in fact, we have got what you call as antibiotic stewardship. So from if you are a layperson, and if you don't know, then I will encourage you that do not start antibiotics. You need to reach out to a health provider, and they need to be monitored. And the way they want to be monitored is by looking for signs of infection. When you talk about sepsis, chemotherapy is just an example. All of us are vulnerable to it. It is body's hyper response to infection. Not every infection gets septic, but infection body's hyper response. And where the hyper response happens, when for you as a patient would be, you start getting chills, you get dizzy, you get confused, you stop going to the bathroom, you feel exhausted, you feel your body's breaking down. And the only thing I'll request you all is to ask the simple question and reach out to your healthcare provider. Do I have sepsis? Let the burden be us. Let us help you with that. So don't start antibiotics unnecessarily. That poses you and others around you. Get your immunization done. Get your flu shots done. Basic hygiene makes a big difference. We want to spend time in prevention because 80% of patients are showing up with us, and we want them to be picked up and treated.
Councilmember Lee.
Thank you, Mayor. Dr. Masud, it's good to see you. On the protocol, Methodist has its own protocol, I presume. Is that followed, or you guys follow the Surviving Sepsis campaign by the CDC?
So the good news is a lot of the work we did at Methodist is part of our guidelines. Let me tell you, I've been at it for 12 years. In Methodist, we have dropped the mortality of the death rate by 85%. It used to be around 38% in 2008. Now it's 6%. We are the nation's leader as far as things. We've shared that in our medical center. We work with CMS to increase care processes in 1/3 of Texas. What we have not done a great job is raising awareness, and that's what I feel
Motion to
very
extend. Any
Second.
objection? Chair is not granted.
And then you quoted 10% of the patients who present to the hospital has sepsis, and 85% are detected in the emergency room. How many percentage of this 10.6% is actually nosocomial related versus community?
So nosocomial really means that these are the infection which develop in the hospital, and quite a few of them do develop in the hospital. And I would say 80% show up with ED, and I would say more around 15-20% develop in the hospital. That's where the process in the hospital are also very important. Preventing infection, hand hygiene inside the hospital is very important. Giving antibiotic, cleaning up the space is very important. But what we want to do is we want to raise public awareness so that they show up earlier. They reach out. Not everybody has to come to the ER. They reach to their doctors and they can follow them and monitor them. I don't want people showing up to the ER, but I do want patients to ask and reach out to their healthcare provider and ask a question. If we don't ask a question, if they don't know what to ask, how can we help them to get better? So we want to educate them to what to ask.
No, that's great. I mean, we already spread a lot of the knowledge on heart disease and stroke and the signs of heart disease and stroke. The majority of the public knows that, but you're right. As far as sepsis, what are the signs? Nobody knows. So I'm glad that you're bringing up this campaign and putting it out to the public. Thank you.
I want to partner with you all. I'm offered to help you all. I think there are a lot of people like me who are willing to help, but we got to raise awareness.
Thank you very much.
Thank you. Councilmember Kubash.
Thank you very much, Doctor. I got to talk to you before we come to council today, and I've been close to being septic because of staph infection, but I think early detection is what you're really saying too, and don't self-medicate. Get a professional opinion.
Just ask a question. I keep on repeating. I want, when you're getting sick and not getting better, if you have an infection, start getting red streak, I want you to reach out to your healthcare provider, ask a simple question, do I have sepsis? I can't, just keep it simple. Do I have sepsis? Let us help you.
I'll tell you, Doc, before I ever get a red streak, I'm going to be at my local physician. Thank you very much.
Thank you, Doctor, and appreciate you being here today.
Thank you so
Thank
much.
you. Thank you for the information.